Thank you. Allow me to give the floor now to Vladimir Puzovic from Serbia, the College of Sports and Health, Belgrade, the Doctor of Sports Medicine and Applied Neurophysiology. He will speak about the injuries in the lower pain, rehabilitation, and return to competition. Esteemed President of the conference, organizers, colleagues, professors, I'm from Serbia, and I will try to speak Russian. If it doesn't work, then I will refer to English. Right, so I am Vladimir Puzovic, and I work at the College of Sports and Health. Have been working for about 15 years with athletes, their rehabilitation and physical training. The topic of my presentation today is the injury of the lower back and pain, because there is no clear definition of that pain. Most of the definitions just describe the emergence of pain, whether it occurs once or many times, and chronic pain of the lower back. The low back pain manifests in the population of the non-athletes. But when we take athletes, then there is another problem emerging. Very often, this group includes children, includes older people who are going in for sports for health. For them, sports is not the purpose of achieving certain results. As for professional athletes, low back pain emerges quite often. About 50% of athletes go through this problem. At least once in the career. Sometimes they suffer from chronic pain, and 8 out of 10 athletes come across this problem.
Sources of pain.
What are the sources of pain? In most cases, they begin with the disc pain. Sometimes there is hernia, but not always. If there is hernia, then there can be a pressure on the nerves, which can also be the sources of pain, or the sources of pain can be associated with the spine as such, and with the deformation of the spine. Screening, according to many authors, should be carried out by professional medical doctors who understand the problem very well. The coaches and the rehabilitation professionals should be also very well familiar with what kind of tests can be applied and what motions are needed, in order to understand if there are negative effects.
Because if those problems are there, it has got a negative effect.
Immediately advised. Кроме клинического исследования,
Apart from clinical studies and radiological studies, it's highly recommended. MRI is very important. It's the golden standard. And screening and RTG, there are experts who are well involved in that. They would also do the screening and MRI.
To show is there a damage of the disc or not. Если говорим о treatment спортсменов,
as to the management of athletes and pharmacological treatment, we should figure out which medication should be there, but medical drugs would only conceal the pain, they mask it, they will not remove this problem, which is very hazardous for a sportsman as well.
Второй шаг
Another step to resolve this problem will be about physical exercise, specialized exercise. When we don't see disc herniation, so we do this treatment for an athlete. So that's recommended to conduct this treatment within 6 or 12 weeks. And if there are negative
consultation is immediately advised. Exercise program должен начать сначала.
First, we should start from working up the spine, extension of the spine, but without hyperextension of the spine, which might deteriorate the problem. Young athletes may have got some problems as well, but there could be a very good rehab problem. So young athletes could be fully rehabilitated as well. As to spondylosis, this is rather different system. First, we don't do anything. An athlete should rest first, otherwise there might be spine hyperextension. There is a specially devised rehabilitation program. This is when pain is there, but if pain doesn't stop, doesn't subside for a long time, a professional medical doctor's consultancy is needed. I would like to refer to one case study. We received the patent in April 2022 for that. There is the shoulder injury of an athlete. The athlete was in car accident and he had a leg and back fracture. For 2 months he was fully immobilized, but even after that, for 2 whole months, he looked that way. The condition has worsened due to the back fracture and femoral fracture. He rapidly lost weight and he lost body mass in the legs. We started the rehabilitation from lying position because it's most safer position.
Sitting position is not the most recommended one. The
Sitting position.
Pressure in the low back, because of the pressure in the low back, but unfortunately due to the femur fracture, we couldn't put him standing for a while. Хирург сказал, что операция очень хорошо сделана и что ему обеспечен возврат.
So the results were very good. So the athlete would be able to return to professional sports. But some experts disagree because we can see that the spine moved backward.
Я не знаю, если видео работает, это пару дней назад, вот результаты реабилитации.
Here you can see the outcomes of the rehabilitation, which are quite good. And here you can see that the patient recovered body mass and his movements are almost free, but we cannot come to final conclusions whether he can return to professional sports. In conclusion, I'm here to express my heartfelt thanks to my colleagues, neurosurgeons, who are helping me constantly. Thank you so much.